We'd like to take you through a LASIK procedure to show you what is involved having laser surgery to correct your eyes. But first, we put some eye drops in to numb your eyes so there is no discomfort at all during the entire procedure. We put a lid holder in to keep your eyelids apart so that you can't squeeze during the operation, and it gives us the exposure we need to do the procedure. Again, there is no discomfort doing this. Once we have the exposure that we want, we mark the cornea with a marking instrument, and this will help us align flaps when we are done with the procedure. We wash the eye off with some cold balanced salt solution and prepare to make the flap of tissue. Using a mechanical device, much like a carpenter's plane, we put this on the eye and exert some pressure because we need the eye firm, and we confirm that the eye is nice and firm, and you will see now that the keratome will move across the eye in a very controlled manner and create a beautiful flap of corneal tissue. Again, there's no discomfort at all during the procedure, and you can see how the patient's holding perfectly still. The keratome is removed, and at this point we will check the flap to make sure it has been properly performed. The flap is very thin, measuring approximately 140 microns. This flap is perfect, and now we just measure the residual thickness of the cornea to confirm what we had measured preoperatively to be sure there is enough corneal thickness. We clean off the cornea and refocus the microscope. We put on the reticle that allows us to center the laser beam, and once it's centered, the laser starts working. Now, the laser itself is invisible so that you cannot see it, but you see the bluish tinge from the area of the pupil. The laser time varies with the amount of correction that we are trying to achieve. Again, you see that the patient is not moving, and the laser actually can follow very small movements of the patient's eye. Once the laser is completed, the operation is basically over, except that we have to replace the flap. We irrigate under the flap, put the flap back, we irrigate underneath the flap, and you can see that the lines that we made on the cornea prior to the surgery now are perfectly aligned, much like a jigsaw puzzle, so that we know the cornea is back in the proper position. At this point, we just have to wait a minute or two for the flap to seal down, and we squeegee or iron the flap, let the flap seal down, and the operation is over. We then put in some eye drops, some anesthetic, not anesthetic, but some antibiotic and anti-inflammatory, and we remove the lid holder. We check that the flap is in good position and go on to do the second eye